Hi, welcome to week 4. This presentation correlates to chapter 4 in your family health nursing textbook. This week we will be looking at family assessment and planning interventions, and it kind of goes to thinking about assessment as being so important that we need a logical, systematic approach as we deal with the complex social systems that are our families in order to make sure that family needs are met, that we can uncover gaps in their care plan, and offer multiple resources for support. The family nursing process follows the nursing process that you're aware of and begins with analysis of the family story, looking at designing a plan of action, then coming up with that implementation of the family intervention, evaluating it, and then reflecting on the process. So depending on the families that you'll be interacting with, your textbook talks about the nurse in the role as assessing families. And I want you to be thinking about in your primary care role, how will it differ maybe than the approaches that you've had if you're currently in an acute care setting. So think about the nature of the disease. Is it acute or chronic? What setting are you in? What are the characteristics of that patient? And then we'll be talking about using family theories. So the data collection begins with that first encounter, whether it is in person, a referral that may start with the phone. So what kind of information do you gain? Some of it would be objective, and then beginning to listen to that family story. So what is their knowledge? What is the information that they need? What previous medical information do you need to become aware of? Insurance, etc. So a typical family assessment may begin with a referral and then collecting demographic data and then deciding where that visit should occur. Again, most of the time you'll be seeing patients as a nurse practitioner in a clinic visit, and you might want to think about, okay, who are the family members that need to be present? For the paper assignment, you'll most likely be visiting families in the home versus a clinic. So think about the advantages and disadvantages of both. The home can be an opportunity to see the family in their everyday setting. What are typical interactions? You may be able to meet more family members and have them participate. The family can feel safe. However, it may feel too much like a social visit rather than a professional visit. The clinic would give you easier access to referral sources. You may be able to see strange situations more clearly in that clinic setting, and the family may feel intruded upon, and that may reinforce that culture gap between the family and the healthcare provider. It's important at this early onset to determine the need for an interpreter, since English is not the primary language in 46 million homes. We know that language barriers can lead to decreased comprehension of healthcare instructions, decreased adherence, adverse health outcomes, compromised quality of care. We may have avoidable expenses, dissatisfied family, and can lead to medical mistakes. So think about the need for interpreters. A family member may be all you have. However, they may buffer information or censor inappropriately because they don't have medical interpretation skills or a good understanding of the medical terminology. If you're using a child, there's developmental risks and limits. There may be confidentiality issues, and the topic may just be too personal. A qualified medical interpreter can interpret medical conditions, and they can translate accurately. They are an outsider talking with the family, so it may be difficult when there's specific personal issues, and it may be culturally not received as well. So in thinking about making decisions, that health literacy is really important because we want to all be on the same page. So it's crucial to develop that partnership and to achieve outcomes. So that beginning family meeting, think about introductions to all family members, talk about who's not there. And this is an opportune time for you to develop that trust and rapport using the therapeutic communication skills. The family genogram is your first assignment on assessing a family, and your textbook goes over the information needed to collect that data. So you look at both health situations, social situations, etc. There is specific key symbols that are used. The Gina Pro is a free program that you can use for a short window of time. So to do that, and you can submit that, I have the Gina Pro program and I will be able to read that for you. But if you have a Mac, it does not work with that. So you may want to use Word or Excel just to use these symbols so that you can clarify the relationships. So here's a sample genogram. You start with the individual. So here it is a 15-year-old and look at 2 previous generations. You can see that social situations, the deaths, the divorce, education, chronic conditions, adoption are included here. And your textbook has some others examples. Another family assessment tool is the Family EcoMap, and it is a visual representation of relationships, communication, support system outside that immediate family. So the key shows you can indicate some relationships, and so you may see where energy flows out and into that family and where there are stronger relationships. So both of these are essential in assessing a family because it begins to tell us what our support systems may be outside the family, what are the stressors inside that family. All of these can be information that you can gain through your family assessment. It begins to tell you the importance. What are family roles that are just beliefs that no matter what, that the father must be the primary provider, etc. And some of the cultural and spiritual values that are in that particular family. So if we're using the nursing process with family nursing, again, we go through these steps, again, typical that you would use in your nursing process with an individual patient. The family reasoning web is talked about in your textbook as a way to organize that family assessment and looking at some of the important components and beliefs for that individual family. And then after you've done that assessment, it's going to be important to come up with a family action plan. And we think about families need consistency, clarity, comprehensive information, and feeling like they're involved in the decision-making process. And as we think about patient family-centered care, this is where, as you design that family action plan, it can be so important. And nurses can either positively or negatively impact that action plan by how they control the information given, how they control access, and how they control relationships. The patient-parent information and involvement assessment tool is discussed in your textbook, PINT by Sobo, and it talks about, with the pediatric patient, the level of information that is received. So looking at whether it's simple when we're determining how much information to share, and then who's involved in the decision-making process. So it may be just no involvement to that who is that primary decision maker. Here are some qualities of shared decision making, and we think about, in best case scenario, that there is agreement on what the health problem is that's facing the family, and that all options and questions are invited. Pros and cons are discussed. We consider values and preferences. What is the family's ability to follow through with each option? Is there need for clarification and more understanding? And then how can we track those outcomes of the decisions made? So as we develop the intervention, we have to think about reasonable interventions based on cost, efficiency, effectiveness, feasibility, and strength of the family members. And they may be including providing direct care, looking at removing barriers, or help the family just to act by themselves. So outcomes should be realistic and based on that family's ability to adapt, their strengths, how they responded similarly in the past, and it might be a preventive outcome, minimizing risk, stabilizing them in the case of a more chronic condition, and recognizing the progression of deterioration. And this outcome statement looks at that, recognizing the progression of deterioration. So asking about having the family obtain counseling with a grandmother's who is progressing in her Alzheimer's disease. If you think about that evaluation process, it is so important to determine, has that outcome been met, or do we have to continue and revise? So the reassessment phase has you look at, was the family involved? Were they apathetic to the process? Were they able to make decisions, or overwhelmed? Do they fear failure? They feel hopeless. So we want to come back and see, was that helpful to them? And then think about ending that therapeutic relation. So here are some questions to ask in that reflective process. Were there successes? What kind of knowledge and pattern recognition did the nurse gain by her listening to the client's stories? And was that nursing care provided effective? There are in your textbook several family assessment intervention models used, knowing that no single theory or model fits all the time. It may be a combination that you're using. However, your family theory paper will ask you to choose one of them, and it's really just the family assessment and intervention model or the Friedman model, and both are described well in your textbook, and samples given in the end of the textbook. And this looks at a comparison of the approaches, so gives 3 of them, and it looks at the strengths of each. So for instance, the family assessment intervention model is focused and brief, and it compares responses among different family members. However, it only addresses 2 variables, family strengths and stressors. The Friedman family assessment model is considered to be more comprehensive. However, it does have a large amount of data, so it's hard to organize. And then the Calgary is also presented in your text. So you want to think about what assessment model helps you to accurately identify strengths, problems, outcomes, intervention strategies, and evaluation plans. It is really a combination of using tools, so the genogram and ecomap help you to begin that assessment. You want to think about using the family reasoning map, because it helps you to consider really a holistic assessment, and then some of the models that are presented. Key is that the family is involved in the decision-making process, and that nurses can help guide families through that. In this week's discussion blog, I'm asking you to informally complete a family ecomap on yourself, a family member, or any individual that you choose, and talk about 2 to 3 social support networks for the family that could be used if the family were undergoing an acute or chronic health event. And how would you communicate to the family about using an alternative solution or support network? You don't need to provide a visual here. You would just describe those networks and how you would communicate them to the family. And then your genogram and family assessment assignment is due on October 6th. The assignment directions are posted in the assignment link, and then I'm hoping to post the visual of them for your classmates to review. You'll upload 2 documents. One will be your genogram and one will be your reflection. And the reflection is an important piece of that. I have a rubric posted in the course. So please make sure that you really spend some time to do that analysis, because it's one thing to present the information, but you want to say, what does it all mean? So I look forward to seeing your genograms and hearing your discussions on the ecomap. And as always, if there's any questions, please let me know.